So today we have speaking about EarthRanger Health, Dr. Steven Chege and Shaleen Angwenyi. So go ahead.
Good. I think you did it very well. She was asking me, how do I pronounce Angwenyi? She did it very well. So good afternoon, everyone. So I don't know how many of you were in our first session, but suddenly everything has gone down. I was trying not to preempt this talk, but it seems like I did that. So that's a bit disappointing. But anyhow, I think we'll go ahead. And this presentation we'll be doing together with my colleague, Dr. Shaleen. Yes, and we are doing this on behalf of other parties. And as you can see from the logos, we have different teams from the Ministry of Livestock and Ministry of Livestock, and we are discussing wildlife. It's because disease in Kenya is actually under the Directorate of Veterinary Medicine. So, and we have been working together, and also KWS, WTI, which is the research arm, and other partners. So Smithsonian, San Diego, and many others. So I'll take you briefly. And a bit of introduction. You know, everybody talks about poaching or the threats that we find, and disease now is becoming a big threat, not only to wildlife conservation, but also the public health. So it's important, all of us, to keep collecting that data and understand how to deal with it. And I think most of you are working with wildlife. We know that diseases have led to animals getting sick and mortalities. And this morning we discussed a few case examples where we have had animals dying in big numbers. In fact, the picture that you see down there, those were Saiga antelopes, which they died massively. These were huge numbers in Kazakhstan. I never be able to pronounce that name, but I'm sure you understand it very well. Yes. So it's crucial actually for us and the people working out there to be able to detect these outbreaks well in advance, so that at least we can prevent this kind of losses. Again, this slide is very common. 60% of the known infections actually in people, they originate from animals. So you can see this disease, it's not only affecting our wildlife, it can also affect you and I. So it's of public health importance, and when we talk about the zoonosis, and what we have seen is most of the times when you're talking about like monies being allocated for wildlife diseases, you get very little in terms of the allocation. But the moment you talk about the public health, people happen to listen to you. So it's important, even you, because you're the people on the ground. And I'm sure you already know this, but anytime we are talking with the policymakers, I think that is a strong message there and showing the need for that. And you'll find that more than 75% of emerging infections, they are mainly coming from animals and more so wildlife. So you can see the need for us actually to really be in the forefront. I'll just quickly give, a quick point there on disease and the effects of humans, or the kind of anthropogenic threats that we know that we experience them. So that case you see there is, I'm trying to see, did you change this? Yeah, I hope this is not putting it off now. Did it do? Anyway, what I wanted to mention there, if you look at that, I was wondering, did you change it? That is a virus, which we call canine distemper virus. And we have seen it affecting animals, not only the lions, but even African wild dogs. And there is this paper which was done by the late Manson, Professor Manson, Linda Manson, And they looked at some work in Serengeti, and lions were dying in big numbers there. And at the same time, what was happening, there was a serious drought. And so they looked at some serological work. They did some serological work, looking at the samples that had been collected previously. And they found out that the canine distemper was actually happening, like for many years, but it was not really causing serious mortalities. But during this time, there was a peak. And the questions were, why is it happening now? Yes. At the same time, they found out that those animals were having babesiosis, which is a tick-borne infection. And normally you'll get these ticks. They will be in the host. It could be a buffalo. It could be other host. And they were dying in big numbers. And that exposure and the co-infection actually led to these lions dying. And you ask yourself, there is endemic stability that you get with these diseases. The animals are able to survive with some diseases without really causing serious threats. But when you have a stressor in the environment, like that time, there was a huge issue with the drought, and buffaloes were dying in numbers. But at the same time, the predators also died, and this was due to that fetal infection. So you can see the connection and the challenges or the things that we bring on board as human beings. And in Kenya, I know most of animals, and I think it's everywhere, when we have huge mortalities, and especially if it happens during drought, all of us blame starvation and drought. What about, could there be something else? So I think it's important for us to be seeing that this is happening. It could be, what time did it happen? So the issue of the seasonalities, yes, and we try to dig a little bit deeper. So I mentioned the EarthRanger health, and I think I was cautioned not really to keep using the EarthRanger, but this is from the ranger perspective. You know, wildlife, you find it in very remote areas. You know, there's poor infrastructure, and not everybody really gets to, not so many people are getting here. But the rangers, this is part of their daily work routine. And most of the rangers, I know previously, most of the rangers have been focused on, trained on, to focus on mainly security. But we have been asking ourselves, could that be a good resource to train them actually to help us collect more data? And not only, and this is both ecological data and the animal health data. And if you look at it again, it's by doing so, you know, if I give an example like Kenya and the way the veterinary department is organized. So we used to have only the veterinarians in the headquarters, that is in Nairobi, and would only go in to the different fields based on where the disease outbreak is, or maybe there's a case for treatment. And all that information was always coming from the rangers, but it was never really integrated in a way that you can capture that information. And so we thought now, with this kind of a platform, the EarthRanger, that gives us a nice platform actually to train these rangers. And again, Shaleen said, please don't keep using the word training, share with them and see how they can help us collect these animal health data. And by so doing, you'll actually be, you know, minimizing the cost and actually maximizing the benefits, so, because you're able to detect if there's anything very early. Good. So I think this is last year, we came up together, all the different organizations I talked about, and thought of developing an animal health module. And we said, okay, let's use Kenya as a model for that. And note that the information has not been collected before. So the Directorate of Veterinary Services, which said that has a mandate to collect or manage diseases, animal diseases in Kenya, had already started something we call the CABS. So this is the Kenya Animal Biosurveillance System. And this was geared towards the professionals, the veterinarians, or the animal health, the vet professionals, and was not really capturing the other people out there. Most of us were trained, but there was a huge focus towards livestock data. And yes, a few of the wildlife species were incorporated, but we thought there was still a gap. And the question we were asking ourselves, okay, then what can we do? And the idea of using the EarthRanger as a platform came in very handy. And why EarthRanger? It is actually filling that gap. We have the veterinarians or the vet professionals, but who are the people spending the time with the animals? It's actually the ecologists. We have the rangers. And we brought on board the rangers, the wardens, the ecologists for training, but still within the caps, some information was actually lacking. The other reason is we have the rangers already using a different database. Why do you want to add more work into what they're doing? So that compliance becomes a challenge. And so we thought it would be good to actually just add into it and collect the animal health module, the animal health data. That would be of help to us. This is a slide that I was trying to get that ranger use. I think it's already happening in Kenya, and I hope this is the correct information that I got this morning. More than 62 sites now already using EarthRanger. This is not the EarthRanger Health. I'm talking about in general. So people already running with it and collecting other data like human-wildlife conflict, the sightings. But the animal health part is not yet there. Just quickly to mention the kind of diseases that we have encountered in Kenya, especially in wildlife. I know everybody must have encountered anthrax somewhere. And in Kenya, we have had some outbreaks affecting, including even critically endangered species. We had zebras in 2006, and a great number of them also died. And these grave zebras also, they are found in very remote areas. And I remember that was, it was a huge, huge challenge, even getting to manage that. So the rangers are out there. They have seen the animals are dead. By the time they try to get you from the headquarters or from wherever you are based, that takes time. And in terms of the response, becomes an issue. We have had diseases like the mange or the sarcoptic mange, affecting mainly cheetah and gazelles. And there's at least people can be able to see the loss of hair. Sometimes there's scratching, and that gives you a clue. It could be the mange that you're dealing with. Yes. And I talked about the canine distemper. 2017, a whole pack of wild dogs was wiped by that disease. Again, by the time you are getting to see this, there are people who are on the front line who would have reported maybe early in advance. So you can see all this. Rabies is not new. In Kenya, is an endemic disease. And we have, there's a good strategy now to eliminate human-mediated, dog-mediated human rabies by 2030. So not only focusing on wildlife, but at least also the human beings. And that is giving us a good leverage because there's some money to look at it, the disease from the public health perspective. And also our animals do benefit. And as we know very well, rabies, more than 99% in having or calling ourselves wildlife veterinarians versus the domestic animal veterinarians. I think there's nothing like that. The big threat is the disease. How can we all work together? And you find out like in Kenya, especially within that interface, we have been having rabies vaccinations campaigns targeting domestic dogs. We are not doing very well in the country because we need to do more than 70% of the dog population. I think we are less than 30%. So there's still a huge, 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 huge gap. Good. Again, maybe I don't have really to continue talking about this, why there is a need to have a surveillance system. I talked about the early detection of the disease and rapid response, early warning in cases of zoonosis. And again, you want to identify these hotspots. And what happens when there are different issues like change of weather? What questions do you bring come to your mind? So I think maybe I don't need to belabor that point very much. Good. So coming to our module, I think the idea here is try to connect the people working in remote landscapes, and these are our rangers. They're already out there. They're collecting the data, but more importantly, that data that they collect need to be useful to help us in decision making, either for conservation purposes or even protecting the public health. Coming to the health module development, so the different stakeholders, so we had wardens, we had veterinarians, those working in the wildlife sector, also the ones working with the domestic animals, and we were asking ourselves, how do we come up with this? So we held a workshop, and there were different areas that we were looking at. I'll be mentioning that. And then the biggest question again, we were asking ourselves, we don't want to come and start something new. There's already something that is happening. I talked about the Kenya animal biosurveillance system. So this data that we are collecting, how do we integrate it with the already existing system? And yes, so what we did, again, all this is based on syndromes. What is it that you can go out there and see? Could be the ranger, you as a veterinarian, anybody. The animal is manifesting something. How do we collect that data? And again, we ask ourselves, what diseases are of importance in our situation? And you can see this column here. There are those diseases that have a huge conservation value. There are those that are impacting the livestock, and the ones that with zoonosis. So if I can take an example with rabies, what kind of things do you see? Like you find that there's unprovoked aggression. Again, that is something that a ranger or somebody out there can be able to see. The fear, loss of fear. Again, in the morning, you remember we talked about the animal behavior. So if you see that there's a change of the normal behavior, that could be an indication that there's a disease that is happening somewhere. Yes, and if you look at the rabies, it has conservation value. I talked about wild dogs. Good number of them have died. It can affect livestock because it affects all warm-blooded animals. And then it's zoonotic. It can actually, when you get that dog bite. So that is a criteria that we used, like to get to know what are the key diseases, because we wanted to use that to capture and manage, try to capture these diseases. And likewise for the different diseases. And most of it, if we can just everybody out there can be able to see. I talked about mange, skin loss, and it's not that any animal that has lost skin, there's loss of hair, there's a mange, no, but at least that could be an indicator. So that's how we decided that, and this was modeled on some work that was done in Uganda, that was by Predict, and this model was looking at like generally what we all do, animal details, whether it's alive or dead, if it's injury. And this is very common, especially even for the security teams. The first thing that everybody looks at is, has the animal been poached? You know, that could be loss of either the tusk or even the injury itself. And could it also be infectious? If it's a death, again, what kind of information that you do collect? Yes, so Dr. Shaleen, I know will be talking about more about the trainings, but the idea again is using the already existing platform. So as you come in, we call it the animal, the veterinary. At least it's easier for anybody to pick up that, and can either choose either live animal or dead animal, and then you can put in all the details. I saw you mentioning that I have 1 minute, so we'll try to show you that details. Maybe if we save a little bit of time, but more importantly here is normal animal details that you do collect. Where is it? At least that can pick up itself, who is reporting it. And it's important to know who is the reporter, because we need to follow up. You know, there's nothing that you can do without following up. And once that is all filled in, at least you have an option to add in notes or even put an attachment. Because the way we have designed it is we want people or the rangers out there, as they put in their mobile app, they can be able to also to take some pictures. You know, pictures speak 1,000 words. And again, the dead animal, you'll also realize that we have other databases that have been collecting dead animal data. Most of people call it a carcass or carcass information. And again, that is where we need a lot of harmonization with other people who are collecting that data, because it's the same information, but we want to avoid different terminologies which can cause problems. Dead animal or a carcass. I think we are talking about the same thing, but if it appears separately, it can be a bit misleading. So I think what I'll do is I'll leave it there, and I'll invite my colleague, Dr. Shaleen, to continue and talk about what you have achieved so far. Thank you.
Okay, going down now to the work that we've been doing in the field over the past year. So that's again just showing a bit more about the different health or other disease syndromes that are present, but I'll move on a bit. So going forward, what we've been doing is piloting this module as it's been shown. If we get time at the end, we'll be able to actually show you the different templates for the live animal and the dead animal one. But the plan has been to pilot the health module in 13 protected areas in Kenya over 2 years, which is this year and next year. And we are training the rangers to recognize and report disease symptoms, and having that data, once they fill in the 2 templates, in real time, the reports are being sent to the vets who are in charge of that specific area. So again, just ensuring that the response times are as quick as possible. And that's a list and a map showing the different areas that we are hoping to pilot this health module. And when it comes to reporting, just 1 second. Okay. When it comes to the reporting and during the health trainings that we have with the rangers, again, it's just going through the 2 different modules, the dead animal and the live animal. So the live animal, if it's a sick animal or an injured animal. And then how they input that data into the app, because most of the rangers have phones. We're very happy to see that. They have phones that have been given to them by the conservancies for work. So they're able to input the data into the EarthRanger apps. And then, as I said, having the reports being sent directly to the vets, we hope that we have quicker responses than we would if there's so many people who have to get the information before the vets do. So that's me treating a gravy zebra at the bottom. And during the trainings, what we have is basically, again, as we've said, there's a dead animal and the sick animal modules or live animal modules. So the dead animals, again, just going through what a carcass is, what kind of information they should be getting from the carcasses. So again, age of the carcass and the different types of information that they could get from the animal, from age, sex, if it's been predated upon, if there's any missing parts, so in cases of poaching or any sort of bushmeat hunting cases. And then also, again, just being able to say what's a fresh carcass, what's a decomposing carcass, what's a old carcass, and again, just seeing what the differences are. And then we have the second category, which is the live animals who are the potentially sick. Currently, we have the 5 categories that are listed there. So depending, again, on what they're seeing on the animals, if it's a skin issue, if it's a neurological issue, injuries, respiratory issues, and any poisoning or infectious disease symptoms that they are seeing. So the 2 videos are basically just, the bat-eared fox is an animal that's okay, and then we have a limping leopard. So just again, showing them, which they of course know from all the experience that they have on the ground, when they see an animal that's fine, generally there's nothing to report there, but you see an injured or sick animal, depending on what the symptoms are, which of the 5 categories do you think the symptoms fall under, and how you're going to fill that into the EarthRanger app. So that's basically what we go through during the trainings, ensuring that they understand that. Because again, there'd be too many questions for them to fill in if they were just going to scroll through the questions and not know what category to fill. So yeah, once they can see like a limping leopard or like an elephant with a spear, for example, they can just go to the injury section of the health module and fill that in and submit it instead of having to fill in all the data. So far we've had ranger trainings this year in 7 sites, those that are listed there. These have been 14 trainings in total, ranging from 1 training to about 3 trainings in the different areas, depending on what point they joined the pilot in. But we're still continuing together. The trainings have largely consisted of about 20 to 80 rangers, again, depending on the capacity of the different conservancies. And this has led to us having over 300 trained personnel. And this includes the field rangers who are either just doing general wildlife monitoring or the human wildlife conflict teams, the radio room and the control room rangers as well. We've had some conservation and security managers join us as well, and ecologists, and there was one pilot who was very interested in learning, so he also joined in one of the trainings. And again, it's just basic information, because these are people who are always on patrol, always in the conservancies. So anything that they see, they're able to put it into the app, which is then sent to the vets and the other management personnel. So this is just an example of how the trainings are. We usually request to have the rangers sort of in a room with a screen or even a wall, or anything that could work out. And we just, again, go through the module, go through the questions, and just have more of a discussion session, really, to make sure we're all on the same page. Because as you said, I don't like calling it trainings because it's already information they know. It's just us all agreeing on how we're going to get this data standardized in a standardized way and make sure everyone's understanding each other. So that's, again, like one of the sessions that we have. And here's another session that's now specifically for the radio room rangers. And again, just having a feedback session as you go through the questions, make sure that everything is understandable, and it'll be easy, relatively, to fill in any of the data that we are requesting them to do. And so yeah, we have the field rangers and then we have the radio room rangers, depending on, again, the conservancies and what their reporting systems are like. So as much as everything has been great so far, and we've had so many people that we've been able to train, we have had some challenges in developing the module, and also sort of like during the trainings as well, and making sure the data is coming in smoothly. So the first issue we've had is there's no setting for setting up conditional questions for the health modules. So for example, if they find a bird that's dead, or no, let's put a sick bird, they'll still have to answer a whole lot of questions that are not bird related. So it's been a bit difficult in terms of that, because again, the rangers have a lot of work that they're doing. So if you're asking them to fill in very long reports, then also we have to think of, one, their time, and also in the long term, if it's something that they're going to stick to doing. There's also no default yes or no questions. This, again, comes up in terms of if there's too many questions that they have to go through and tick yes, no, yes, no, yes, no to every single one of them. It's also a bit tough for them to be able to go through everything. The next one is, because of differences in literacy levels in the different conservancies, even within the conservancy themselves and the ranges. Some have requested to add photos or icons next to the questions or like to the animal species so that it's easier for them to understand what the question is or what the species are when they're selecting the different answers to the sections of the report. Unfortunately, we don't have the option of being able to add any photos or icons next to the questions, but we've been told SMART does. So again, learning and comparing the two different apps. The next one is, again, also, I think, came up as a comparison to SMART as well. There's no option of just like downloading your reports at the end of the month and that sort of being compiled in itself as a report. You kind of have to do that manually, or again, I think Tableau or Gundi, there's other ways you can do it, which we're here to learn this week. The other thing, there is the truncated questions, if you can see in the middle photo there. So on the phones, you're sort of limited to the number of words you can put in. So if your question's too long, which is what we'd like it to be because it's easier to understand for the rangers as well, they kind of are truncated and you can't see the whole question. So we've ended up having to shorten the questions quite a bit, which for people who are into grammar and being grammatically correct, like me, it's a bit tough to see like the broken English just trying to fit in the question into something shorter so that it's more visible. But again, something we can look into. The other thing there is GPS tracking inconsistencies. So in this photo here, so this is the border for one of the conservancies where we're doing the training. And this line here is one of the rangers' patrol areas, but sometimes a random path just shows up, like crossing into someone else's territory where they haven't been. So yeah, there's some concerns in terms of the inconsistencies in tracking. And the last one, of course, is network access limitations, which I guess different areas have, but a lot of these remote places don't have that much network. So a lot of times when they are collecting the data, they have to either wait until they're back to base where there's network or there's Wi-Fi for them to be able to submit the reports. Going forward, again, of course, we're all working synergistically, have to ensure that the data that we're receiving is feeding into the national surveillance systems. So that's from the wildlife sector, the Ministry of Tourism, for them to understand, again, what's happening with the wildlife. From the domestic animals point of view as well. So for the EarthRanger, we hadn't mentioned before, for conservancies where there's both livestock and wildlife coexisting and not pastoral communities, but sometimes it's pastoral communities, sometimes it's the conservancies themselves, where they have livestock as well on the conservancies. They have the option of also filling in the EarthRanger app when they see sick livestock. So it's not just for the wildlife alone, because again, we all know diseases spread across. So they're also able to fill in any data on domestic animals that are within the conservation areas, and that data goes to the Ministry of Livestock Department. And then we have the Directorate of the Veterinary Services, again, responsible for monitoring all animal diseases in the country. So now we have to find the integration point between the EarthRanger data and CABs, which Dr. Chege had mentioned earlier. So sort of capturing everything about the EarthRanger Health, what we're hoping, the 3 steps there listed. So we have the eyes on the ground, which is what we've mostly spoken about today, having the rangers input the data, and ensuring that that data, again, is being sent in real time to the vets and engaging all different animal health professionals. The second part is the consolidation of that data. So we are hoping to have sort of like an epidemiological intelligence platform so that we can show the spatial and the temporal distribution of reported cases. And then the third part is having developing that participatory model for disease management and linking the data to veterinary responses. And again, incorporating a One Health approach to combating different diseases. So making sure everyone's on board and getting this data correctly. In terms of, again, the rapid vet response, we have set up alerts. So once the rangers fill in the reports and submit it, the area wildlife vet and the area management as well at the different conservancies get an immediate alert. Right now we've set it up as on WhatsApp. And they're able to click on the link and read their full report themselves, and then are able to now, again, plan accordingly as to how to respond to that case. So this is the big team. Chege and I are the only ones here, but of course, no one's working alone. We have the people who, again, conceived the whole concept and lead the strategic development. We have those who provide technical guidance and expertise and helped in the system design and evaluation. And then we lead the ranger trainings and assist with coordination and activities during the field trainings. So we're a big team doing great things. Finally, this is a list of all the partners that we've been working with, and we're truly grateful to each and every one of them, if anyone is represented here. They've been able to take up the pilot with us, and we're able to go to the different conservancies here, and they give us the rangers and their time to make sure that everything goes on smoothly. So, what's the time? Okay. I think I can show you for a few more minutes the health module. So again, it's still just on the EarthRanger. As we said, we have the vet module, live animal and dead animal. Started the dead animal because it's shorter. So as we said, the details that are just filled in, of course, the usual details there, who's reporting it, location, so that's just the GPS coordinates that are always taken. The reporter's details, the name and phone number. Again, this is important because, again, a lot of conservancies, what they've been doing is once a ranger on the ground gets any sick animal, they'll have to, over the radio probably, inform the control room. The control room have to look for the head of conservation. Head of conservation has to look for somebody else. Somebody else has to go find the vet. And there's too long a line as to how the information is flowing before it gets to the vets. So in terms of also getting feedback from the original person who reported, it becomes difficult because you're having to go back down the whole chain to figure out who actually saw the animal and what they actually saw in case there's any misinformation or miscommunication at any point. So we found it important to have the reporter's name and phone number for that purpose. So now in case, for any reason, the vet or anyone in management needs any further information, it's easier to identify the individual who actually was with the animal at that point when it was reported. So we have, again, a bit more on the site details, if there's any dead fetus, how many dead animals are there, any signs of human activity, which of course are your gunshot wounds, your spears, any poisons, and stuff like that. And then you go to your animal details, species, sex, age of the animal, age of the carcass. So again, these are all things that we go through during the trainings when we have them with the rangers. And sort of, again, of the different areas as they are, which can all be attached to the same report. So when this is submitted, the vets and, again, the conservation managers see the entire report, including photos. You can even add videos to it as well, so it's easier to access. For the live animal, it's the same. So as I'd mentioned, okay, just a minute. So yeah, the details at the top, the reporter details and the site details are more or less similar, going down to the animal's details. Then yeah, we have sort of the 5 categories that I'd mentioned before. So the first one there is trauma. Yeah, okay, you can see my cursor. Is trauma, so basically, does the animal have any injury? And we've made sure there's a yes, no, and unsure section for all the questions, because again, we don't want to pressure anyone. If you don't know, you don't know, and it's not bad to not know. So sometimes you're not able to get close enough to a wild animal to assess accordingly and get like correct answers. So again, we want everyone to be comfortable enough to just say, I'm not sure what I saw, but there's definitely a problem there. Okay, so there's yes, no, unsure. Anything else in terms of trauma, where the injury is, and if any of like the following are present, they can tick accordingly. So again, they're all drop-down options. They're all yes, no, unsure. They're all things that the rangers can actually see. So nothing complicated, trying to make it as simple as possible. And then so that first one was the trauma section, and then you have the infectious disease and poisoning questions that are under that as well. So any signs of like diarrhea, worms in stool, lots of ticks or fleas and stuff like that, all go there. And then respiratory issues, coughing, nasal discharge, difficulty in breathing. Then neurological concerns, if the animals are circling, whether they've lost any sense of fear, if they seem more aggressive than usual. And then sort of like what I'd mentioned before with the challenges, like having some of these questions that don't really apply across the board. So if it's like a bird question and you only have, or if it's a lion question and now you have to answer the question is the bird unable to fly. So those are kind of like the things we're trying to figure out. And then the skin section where again, any wounds, loss of hair or feathers, scratching, discharge questions all fall in under there. And then there's a short other section where there's questions about if the animal is blind or not, staying in one place, again, all that. So these are, again, questions that were raised also by the rangers themselves over the years, what they've been able to see, and things that they've reported themselves. So we were able to put everything in based on that. Then there's a checklist also of the site where the animal is, and also any video evidence, again, if you're able to get something good to add into the report. Yes, I'm going to stop there for questions now.
So these reports will go straight to the veterinarian responsible to that reserve, because imagine there's an animal that was reported diseased, and the veterinarian gets that report like immediately, or how does that work, and how does then the veterinarian work with the reserve to go and act? Will the reserve then call him will they want help?
So, thanks for the question. In Kenya, we have mobile vet units, so based across the country. I think there is, how many are they, Dr. Chege?
We have 8 mobile vet units.
8 mobile vet units across the country. Not fully covering everywhere, but they'll move accordingly to where they get reports from. So depending on the region, let me put up the map of Kenya that was somewhere. Depending on the region that the report is coming from, so for example, we are in central Kenya. If you're somewhere here, there's a wildlife vet who's in charge of that area. So if the report is coming from there, the vet who's in charge of that area will immediately get that WhatsApp alert that Oljogi Conservancy, for example, have reported there's an injured lion that needs to be treated. So yes, depending on where it is, the different vets in charge of the different areas who in themselves already have like a mobile vet unit and can respond to the different cases in the area is able to now access the report immediately and then can now plan on how to go treat the animal.
Sorry, I see this working in Kenya, but other reserves may not have a vet available, or vets are generally really busy. And how do you feel like vets will respond? Like, will they even read those many, many messages they will get? And like, that's one of the concerns I'm seeing with this.
I mean, definitely, it's true. I'd say Kenya also, we don't have particularly that many vets. Sure, there's like less than 20 in the whole country. So yes, exactly what you've said. A lot of them are covering vast areas and they're getting hundreds, okay, not hundreds, but like plenty of reports each and every day or every week. What the platform is helping them in is, one, of course, if they're getting the report in real time, then you know what cases you need to attend to, one. And then two, in that you have the contacts for the specific people who reported, you're kind of able to triage your patients, sort of like in a hospital. So you'll know you've gotten 5 reports from 5 different conservancies. I need to attend to all of them, but what's the level of priority for each one of them? So again, yes, definitely, the vets are, there's pros and cons for everything, of course. So if they get a lion somewhere and they get a impala in a different place, then they'd be like, okay, definitely going for the lion first, and then we'll see how to treat the other animals. But not, I guess, not really kind of related to this, just to allude to what you've said, there's definitely a need for more wildlife vets across, I'd say the world, but yeah, speaking for Kenya specifically, there's a need to cover the different areas that are there.
Shaleen, Dr. Chege, it's a really nice reporting system. I think that's probably the biggest benefit of this, is you can go and look at diseases retrospectively and look at the data collection, 6 months or a year from now, and then populate your map of where these diseases are most prevalent, which is really nice. We don't have a system that's wildlife specific like that in South Africa. We do have certain reporting systems that private vets electively choose to use for both livestock and domestic animals in South Africa, but definitely nothing that's wildlife specific. Just out of interest, how does KWS manage both distemper and rabies in Kenya? Obviously they're 2 very different diseases. One's got a huge public health risk. Do you guys do vaccination protocols in your wild populations, or focus on your domestic dogs in a breakout situation? And do you guys wait for breakouts, outbreaks before you vaccinate, or how do you approach it?
Good. Thank you very much. The first part, you talked about getting that data, the trends, which is actually a key thing that we are expecting to get from this module. Because what has been happening previously is that person out there, he'll call you, the vet or the manager, and that's it. And you get, the reports are done, yes, but it's not in a way that everybody can be able to look back and get all that information. So I think that is one of the beauty and the advantages of this module that we are going to have. Even for the cases that don't get attended to, we know that not each and every case will be attended to. Talking about the number of the personnel that we have, in fact, the exact number today is actually 14 Kenya Wildlife Service veterinarians. So if you add Shaleen and myself, we are getting to 16. That's it for the whole country. And we'll never be able to cover the whole country. So what has been happening is the emphasis has been on the big 5, or the big species that will attract a lot of interest. I will tell you, if a rhino gets sick today or gets injured, maybe there will be 3 vets. I don't know where they come from. But if we are talking about another species, that is the reality. It will take time. So those alerts, yes, it could be boring, but also for the vet who will be almost in touch. What is really happening on the ground? Previously, or currently actually, is so that case gets out there. Let's say, for example, is a carnivore ecologist like Lenguya would try to inform the management or the veterinarian, and then they will respond. Sometimes maybe we'll make Lenguya very frustrated because I may not come immediately and he has to stay with that animal. I'm not saying that really is going to change, but I think this platform gives us a good opportunity. Coming now to the specific question on the canine distemper and the rabies. So rabies, what I mentioned is, science shows that the best way to target that is actually working with the domestic dog vaccination. And again, science tells us if you do manage to get 70% of the population or above that, at least you'll be managing the disease. So what has been happening is wildlife veterinarians and the other teams, we try to work together. It's not something that, okay, both officially and also as part of CSR, in terms of formally, you'll find that the Directorate of Veterinary Services that I talked about, they have these annual campaigns, or even talking about domestic dog vaccination. For the wildlife veterinarian, we are looking at, and again, giving an example with Kenya. So when we thought of the 2030 strategy to eliminate rabies, or the country looked at key priority areas. So it's not, again, it's not everywhere. It's where many cases have been reported to. There are some areas where there's a lot of underreporting, like especially these remote areas, because nobody really gets to know that. So the CSR, how it came about, and I talked about the associations. We have associations in Kenya, like Kenya Veterinary Association, has been getting into these areas and try to support the government also reach these very remote areas where we don't have everybody doing that work. There is a study, one study that we were looking at African wild dogs vaccination. It proved very effective. But the question is, effective in terms of the vaccine, it does the work, but how practical is it? You know, these are animals that are ranging quite widely. It's expensive. You get only a few. And again, so you don't get really those good results in terms of, so you would rather really target the domestic dog. And that is the focus, and everybody really understands that. Canine distemper, again, we mentioned 2017, we had that outbreak, and we have been asking ourselves, should we go ahead and vaccinate the African wild dogs? The answer at the moment is, I don't know what to say, it's no, but there's a time we were really talking and discussing with Kenya Wildlife Service, and the justification was like, no, I don't think there's need for it now. But one statement that came up, and again, these are things which are not written in the protocols. In the event that we have an imminent threat, then we can go in and vaccinate them. We have done that with the Grevy's zebra, 2006. A number of them were dying due to anthrax. And anthrax is endemic in the country. We know that, and it will come. People are supposed to be vaccinating the livestock, because again, targeting wildlife is expensive. And so these are critical endangered species. We have lost, I think we had lost like around 86 individuals, and then said, come on, we have to go out there and do something. Looking at the literature, there is nothing. Is this vaccine approved for the Grevy's zebra work? No, you don't get that kind of information. Is it ethically to go in and do it? No. So what do? We wait for them to die? So I remember we quickly did an experiment, and this was purely to see whether there would be any bad effects of vaccinating. And that was it. And we embarked on it. We vaccinated Grevy's zebra. After that, we have done other vaccinations, like when we have had anthrax cases, for example, in Lake Nakuru National Park, where we also have the rhinos. We don't want to wait until, okay, mainly it will come from these other herbivores like the buffalo. But you don't want to sit there and just wait. So we have moved in and vaccinated species like the rhinos. And did we measure that? In terms of the animal deaths or diseases coming down? Yes, it did. But was that measured scientifically? Sometimes no. So in terms of the protocols, it's difficult. So we're asking ourselves, what is it that we can do to really mitigate these diseases? I give an example of the drought and being a stressor, and you get the animals dying because of that disease. So we ask ourselves, we are veterinarians, yes, but I think we should also be spending so much time and working with the other people who are dealing with the ranger's rehabilitation. And if you don't see the connection, sometimes people ask, what's the vet doing there? I think the One Health approach, that is, sometimes you find that there is more benefits, but by looking at things in a holistic manner. Let me stop there so that we can get more questions. We still have 5 minutes.
Thanks. Just a quick one. I know that certainly in Laikipia, probably in greater parts of Kenya, was it last year, there was a big outbreak of the bovine pleural pneumonia. Was that picked up in the system, and did you catch it early because of that?
Okay, I'll go for that. So, just to clarify, we had CBPP, which is a mycoplasma, and this was affecting the bovine and the domestic ones. It was not picked up by this system. I think it came actually from either the community or the people who are doing the trade. That's actually how it came about. And that raises a very important point here, and what Ambrose was asking in terms of the communities and that indigenous knowledge. I think what we are doing is, what is happening is a lot of these things that we do, we make them very formal. So like this one, we have gone to the level of the ranger. 70% of our wildlife in Kenya is outside protected areas. So they are within community land. So what about that community? They have so much information. And to me, I think we are not yet there, because as I was mentioning in the morning, there has been a pull back and forth, bringing these people on board. But I think, to me, because that link is missing, we need to bring them on board. We need to formalize that so that at least you can have a few key individuals from the communities who can help us collect that information. The World Animal Health Organization, which is a big world body for the animal diseases, they actually allow the community animal health volunteers. It all depends on the national system to know how can we capture that, formalize it, make them accountable, and then we move on as a government.
So this is more of a suggestion. Have you guys thought about inputting in your system already a triage? So when the vet gets it, it already has, I know it can be complicated depending on the factors, but it would help the vet to then assess quicker the cases that he needs to go.
Yes, so there's two ways of answering that. Okay, so first, in the module themselves, you can set the priority for whatever the case is or whatever the report is. So depending on, again, the severity of the case and what the rangers are saying when they're doing the report, they can edit that and decide if it needs treatment right now. They'll put it on a red. If it's something like a carcass that's sort of already decomposing, they can put like green or, yeah, again, depending on the case. So the rangers themselves, or the ones reporting, are able to set the priorities. But again, once the vets are able to check in, they can also edit accordingly depending on, again, what they see. So yeah, it's sort of there.
Based on the trainings you've given already, do you see that some rangers are really keen to help out and do mostly this kind of stuff, and others that actually don't really have the interest and would prefer to keep on doing security stuff? And what do you think the best approach is? Do you make two different teams, or do you think everyone should be collecting all the data?
How we are packaging, not really the word to use, but yeah, how we're packaging the trainings is we want the rangers to understand that this is not for anyone. Like, the reporting is not for any specific individual. They're not doing it for the wildlife management guys. It's more, again, yes, the animals, which we are so, I'd say, very blessed to see that to the rangers, the wildlife holds like a sentimental value to them. So there are all those ones of, if whatever I can do to make sure the wildlife are okay, I will do it. So it's been very nice and encouraging to see that. But also for the wildlife side of things, as much as, again, we're training them how to see these disease syndromes in wildlife, it's cuts across to their livestock. And all of these rangers, or like 99% of them, are livestock owners, and they rely on their livestock for their livelihoods as well, apart from like their jobs as rangers. So giving them that information and them knowing that, okay, this isn't just for the wildlife, but I can also take it home with me, teach my children, my neighbors, my friends, and then also it'll help me see what's wrong with my animals as well and be able to get treatment for my own livestock, then yeah, definitely it's something that they're able to see and they're like, yeah, this is a good thing. So they actually keep encouraging us to keep going back and going at least now more into detail with the diseases as well. And yeah, I'm sure there's a few of them who are like, we already have a lot of work doing security stuff. We don't really need this side of things. But generally the majority are all on board, which has been great to see.
We are not sure if, our focus has been so much into these private and community areas. We are not yet there within the national protected parks because there people go like, it's a job. I mean, within a national park, sometimes people don't really see the connection with their livestock. So when we go to the community areas, so this person is working here, but my home is here. So there is a huge that personal connection. It might not be the same with the national parks. So we are yet to find out what will happen. But most important, and I think Kenya, due to the challenges of poaching, and especially with the rhinos, we have seen that the people working with the rhinos, they have huge advanced training and that interest. And so incorporating this and picking it up is actually very fast. And they know this is something that we need to really report, like immediate and follow up. So I think we have a very good background and basis actually to take this to the next step. The only challenge that I would see is we have 14 veterinarians. If I keep reporting and these vets don't come, maybe the motivation will go down after some time. So we are trying to also make sure that at least, again, right now we are doing the training. We will not keep doing trainings. At least identify training of the trainers among the rangers who can be trying to follow up. Yes, to try. We will not ask them to treat because the law, again, doesn't really allow them to do that. But hopefully, once you have the data, maybe we'll end up also having more veterinarians doing the job. Maybe there'll be more money to get more younger vets into it.
I'm going to add one small thing to the motivation part because, again, that's something we've seen on the ground. As is mentioned, we have few vets who are able to attend to the cases. So, again, if they see that they're always reporting and no one's responding, then, of course, they're going to be like, what are we reporting for? But we've also sort of taught them the whole epidemiological side of things. So as much as we tell them, yes, sure, no one might come to treat that one limping gazelle, when it comes to, again, the whole picture for your conservancy, for the region, or the country even generally, that data is also important in the long term to understand what's happening in the different environments. So again, just showing them that there's more to just the animal being treated, and there's way more data that we're going to use the data for.
We are actually out of time, but I think we can allow 2 questions so that we can we move to the next one. But we are free to answer this.
You can find us anywhere.
Hi, I think that was an amazing presentation, and I also like the system, like how you guys are implementing everything. Just to add on what Dr. Andy was asking, my one come also as like a suggestion. I know like with diseases, and we were talking about vaccination, saying because there's like a limited personnel. So you don't think maybe it's a good idea for like those prioritize species, if you're working with them, then you do vaccination at that time. If a lion said is injured, then you know you can use that as an opportunity to do vaccination.
Yeah, again, I think as I said, I think I'm convinced with what you have said, but looking at the logistics, are there the better ways of trying to doing something different that might have more impact? Again, coming to that rabies and the domestic dog, I think that is key. Whether as Kenya as a government we have those protocols, no, in terms of targeting those endangered species. Because anyway, some could also even die when you're trying to go and vaccinate. And then also depending on which vaccine, you might think of doing it on a regular basis. I don't think most of them actually don't have that long life immunity. So you ask yourself, so rabies, you have to do it one or after every 3 years, if you know the individuals. So people will even talk about every year because you're not sure of which individual that is coming into it. I mentioned that I have been in meetings whereby we have asked this question. Now we have domestic African wild dogs that are dying, critically endangered. Can we go in and vaccinate them? And the answer, oh, yes, I think it was like 50-50. Or we didn't want to vaccinate them. But the government was asking, what about these other risks? But if there is an imminent threat, the animals have started dying. Actually, that was the word. When that other animal starts dying, then we can come in. So it's a 50-50 thing. I think we just need more data to convince the management. But I really understand your sentiments, but sometimes I could be in between there. There was another last one. I'm trying to say the last one.
Thank you for the presentation. On the epidemiologic aspect, we have seen some picture collecting samples on dead animal. Do you try to systematically collect samples? Do you involve rangers? And what do you have a protocol? And do you have facilities for the storage of the samples? I mean, yeah, those stuff are practical questions.
I wanted Shaleen to answer this, but I will answer very quickly. The answer is that we inform rangers. We work with rangers. Yes, all the time that I've been in this field, I used to have myself and the driver, and I don't want to say I have turned them to be veterinarians, but yes, because the reality pushes you to really train them so that they can help you do your job. Do you involve them? The answer is yes. If you're doing a necropsy, collect the samples, yes, they need to know because you need that extra hand. That is one point. The other thing is in terms of the sample collection, the preservation, it is a big challenge. We have our laboratories mainly in the headquarters, and we work in very remote areas, so means of accessibility is a challenge. The weather is very sometimes harsh, and you need to have viable samples. So those are challenges that we do face. But as you know now, it's about investing. If you want to keep your sample, for example, in low temperatures or like refrigeration or even frozen, you don't have a freezer with you in your car, but at least you can carry the liquid nitrogen canister. So you'll find that most of the mobile vet units, they're trying to have that basic kit so that when they go in, at least they can be able to capture that. The other thing that is happening nationally is come up with satellite labs. And because you have asked me this question, I think I'll be very proud to say at least our partner, San Diego Zoo Wildlife Alliance, is helping KWS also come up with a few labs or field labs, which, you know, you need quick diagnostics. You also need to keep those samples for long-term use or even other research. So challenges are there, but people have a way of trying to see what is forward. But we need money, money, money. Yes. If you allow me, maybe we can stop there, but we are available. We don't want to keep the other group coming, but if it's tea time and you want us to continue, we are happy to do that.